beginning of this video, we discussed about peptic ulcers, the types of ulcers, and the symptoms associated with the different types of ulcer. If you have not watched the part 1 of this video, please tap on the link displayed at the right corner of the screen because this is the part 2 of the video, which is the concluding part of my peptic ulcer video. In this segment of the video, we are going to be discussing about the diagnosis of peptic ulcer, the treatment of peptic ulcer, and the prevention of peptic ulcer. Diagnosis of ulcer. Physical examination is one of the key factors that will help a doctor ascertain whether or not you have ulcer. While having this conversation with your doctor, it is important to describe the pain and how the pain comes, especially after eating. Your doctor will then go ahead to order for some investigation to know the type of ulcer you have and then prepare a treatment plan for you. Treatment of ulcer. So the various drugs used for the treatment of ulcers are targeted at 1. Killing the Helicobacter pylori bacteria, and 2. Reducing the levels of acid in your stomach. So your doctor might go ahead to prescribe some antibiotics and some acid suppressors which will take care of your ulcers. If your ulcers were caused as a result of regular use of pain relievers, you might be asked to withdraw from taking this medication as a means of treatment. You might also be placed on acid suppressors to help your ulcers heal faster. Please do not self-medicate. It is only a doctor that is in the best position to prescribe the particular drug suited for your ulcer. Again, there are some side effects that you may experience while taking this medication. And these medications are not also prescribed in special conditions like pregnancy and while breastfeeding. Do well to work with your doctor throughout all this process. It is a common practice to grab a cup of milk or a cup of yogurt when you're having this burning stomach pain. But this is a wrong practice. Milk only offers a temporary relief of the pain. Subsequently, milk is going to cause your stomach cells to secrete a lot of acid. Remember in part 1 that we described ulcer as an open wound. So the more acids that are in your stomach, the more abrasion that you're going to be causing to your stomach wall. So taking milk or taking yogurt when you're having stomach or ulcer pain is like adding salt to an open wound. What if you leave your ulcers untreated? Complications could arise if you leave your ulcers untreated, and these can be life-threatening. You can have internal bleeding, you can have blood in your stools and blood in your vomit. You can have a hole in your stomach. There might be inability to pass food from your stomach to your small intestine, and in severe cases, it could lead to gastric cancer. Prevention of ulcers. Stop or limit the use of pain relievers. Avoid spicy fruits, alcohol, coffee, and citrus fruits like lime, oranges, and lemon. They only worsen the symptoms of your ulcer and delay the healing of your ulcer. Instead, you can take fruits like cabbage, papayas, apples, and honey. Quit smoking. And lastly, wash your hands regularly and ensure that your foods are well cooked and your waters are clean and germ-free. It's been an interesting discussion and I'm very sure that you learned a whole lot. Now please save someone by sharing these videos with them so that they can learn too. Very importantly, subscribe to my YouTube channel and turn on the notification bell so that you don't miss out on any of my videos. It's been a pleasure having you. Thank you so much for watching. Stay healthy, mind, soul, and body.